we have been trying to do with our stay-at-home orders and our physical distancing seems to be working. It seems to be doing what we wanted it to do, which was to keep folks out of the hospital. And what we've seen over the last couple of weeks is that we have not seen any significant increases in hospital bed utilization. Ventilator use is under 25% and has stayed really steady. When I talk to my colleagues who are in the healthcare systems, it feels like a calm before the storm. And hopefully that storm will never come. I have no doubt that we'll see an increase in cases and an increase in hospitalizations. But the goal of all of this was to keep our health systems from being overwhelmed so that the most vulnerable members of our community could get the care they needed to make it through. In fact, it's been working so well that some of the plans that we had in place for hospital overflow, these alternative care facilities that the state had been driving at the Richmond Convention Center and then at 2 locations, one in Northern Virginia and one in Tidewater, we've actually started to pivot away from those, recognizing that if things continue on this trajectory, there may actually never be a need for that significant build out of the convention center. And so some of our conversations in the last 48 hours with our health system partners have been about, one, thinking that our health systems think that they will be able to manage the projected surge in the footprints that they currently have. So by increasing space, using vacant space that they're not using for elective surgeries and other things like that, they'll be able to manage the whatever the hospital surge that comes. And secondly, if we need to do something for overflow, we're starting to look at other possibilities. The National Guard, which is currently busy at work in places like New York and New Jersey, but in a month's time may be available to move those field operations down the East Coast. And so we're really starting to consider other ways to meet the surge, but the good news is that surge that we were originally predicting does not look like it's going to be coming.